So in this episode, I would like to address or answer some of the questions that people have been asking me. I mean, since I made this journey public, there's people who are either going through the same thing, or they have siblings going through the same thing, or they're about to get into surgery. And there's some questions that came up that I thought would benefit a whole lot of people. So one, how do you pick the process? And by the process, I mean, how do you pick the implant? How do you pick the doctor? How do you pick the hospital that you're going to go to? Are you going to do it in Kenya? Are you going to do it in India? So this is my personal opinion, and you can take it as you may. I'm not an expert. My only expertise is in my experience. So when it comes to what you choose, the doctor is the most important, because the doctor really is the one who handles everything else. It's better if you're in a hospital where the doctor is comfortable. It's better if you're using an implant that the doctor knows or has used in the past before. And it's also better for the doctor to recommend physiotherapists that they have been using to treat their various patients. And so picking the right doctor is the most important thing. So whether you've picked a doctor in India or you've picked a doctor in Kenya or anywhere else, you're going to hear stories. There's somebody who will tell you, this guy in 4 weeks, you'll be perfect. Please do not listen to such things. It's better to do your thorough research and know that the process of healing is slow. So when you're picking a doctor, it's always good to know a doctor who has worked on somebody else that you know. Go around. There's so many doctors who are well versed in how to do hip replacement surgery. So if you have a doctor who has worked on a relative or has worked on a friend or a friend of a friend, then you're always safer going with that sort of advice. And the doctors usually use specific implants from different companies. Now, most of these implants are actually, I think, from the States, and they do come with a warranty. That's very important. They come with a warranty, so do your research. Sometimes the local suppliers do not give you that warranty, but if you demand it beforehand, then you're probably safe. So after that, it's picking the hospital. Always pick the hospital that your doctor is comfortable with, because they will know from the different nurses, or the nurses know them and how they want their patients to be treated. So please, your doctor is the one who's going to determine all of that. Now, when it comes to healing, there's so many numbers that are going to be thrown around. If somebody tells you that in 6 weeks you're going to be healed, yes, you are. But the only thing that's going to be healed is the wound itself. So in 6 weeks, do not expect to be running around like you used to before the surgery. You're still likely going to be using crutches, and give it, I would say, a year for you to get back to normal kabisa, because in 3 months, you should be able now to walk without crutches. At least that was the case for me. But do not be in a hurry. Take your time. The healing process is extremely slow. So during your healing process, after 6 weeks, it's advisable for you to sleep on the side that you've been operated on. This is for you to get used to that feeling, because it is a bit painful. So you'll be able to do maybe 30 minutes, 1 hour. And also because when you sleep on the other side, if you're a heavy sleeper especially, chances of dislocation are actually quite real. So if your foot slips, or rather your leg slips over, then you're just putting an unnecessary strain on your hip. And just know that for at least 4 months, you'll need to sleep with a pillow between your legs, because you don't want your hip to come like this. So you have to sleep with a pillow between your legs. Whichever side you turn with a pillow. It's also good practice. It's not just for healing. So when it comes to that, that's a very important part of your healing. And the next episode, I'm going to touch on what you need to do in terms of consistency, and also some of the body image changes that you have to deal with.